I'm Wendy Steffes. I will be doing gastrointestinal and abdominal assessment on my patient Morgan Verhoff. Morgan doesn't have any underlying conditions that we know of. Morgan, do you have any nausea or vomiting in the last 72 hours?
No.
Or any problems with your stomach? Do you have any bowel problems? Any family history of bowel problems? Yeah. Family history, most definitely we have bowel problems. So let's not even go into that. But anyway, but you personally are not having any problems at all. Okay, I'm going to expose your belly if that's okay. So I'm just going to roll up her shirt here. And when I first do an inspection of the belly, I'm just going to be looking at her skin color and tone. She has normal skin color for her ethnicity. I don't see any like excessive vascularity at all. She does have some striae, which are stretch marks. Sorry, that's genetics. Apologize for that. I don't see any scars here whatsoever, but I do know in her umbilicus that she does have a earring, and it doesn't look to be infected, or there's no discharge coming out of that, so everything looks perfect with that. Her umbilicus I'm going to inspect as well. I'm going to note the shape. The shape looks good. I don't notice any kind of abnormal contours or any abnormal growths around there whatsoever. When I do look at her abdomen as a whole, I'm also going to look at the contour, the symmetry, looks even on both sides. As I'm observing her and inspecting her, I am going to look for movement. She is breathing normally, not having any problems breathing. I'm going to also inspect to see if there's like normal peristaltic movement that I could see, if I can see her aortic pulsations, and I could earlier, there we go, very minorly. Go ahead and lift your head up real quick and just check for any hernias. I don't see any problems. You're not having any pain whatsoever, correct? Okay. So at this point, I'm going to auscultate her abdomen, and I'll be doing that with my stethoscope, and I'll do it in all 4 quadrants with my diaphragm. And what I should be hearing in all 4 quadrants is like little gurgly sounds. That tells me that she has good bowel movement, that there's no obstructions whatsoever. And I'm hearing those bowel sounds in all 4 quadrants. Next, I would auscultate her aorta. And I couldn't hear it very well earlier, so let me check to see by using my bell if I can hear that. I'm also going to listen for any kind of friction rubs whatsoever. I'm not hearing anything like that. I am going to check for her femoral artery. And I do hear that. And check it with my bell as well. I'm also going to check over her iliac crest here. For her iliac pulses. And what I hear more is more bowel sounds. They're a little bit more dominant. Okay, so that concludes the auscultation. At this point, I'm going to percuss her abdomen. By percussing it, I'm going to listen for my tone and just check to make sure in all 4 quadrants that I get good tone sounds when I do percuss. When I do percuss, I'm going to take my non-dominant hand, use my middle finger with my dominant hand. I'm going to just lightly tap, and I should have what's called tympanic sound. When I get over bone or over her, where her liver would be, then I'm going to get more of a dull sound. So when I percuss, in all 4 quadrants, which I did. Then I'm going to check for her liver and her spleen. First, I'm going to do her spleen, and you're not supposed to be able to really hear anything with the spleen. In terms of your liver position, you're going to go to the upper right quadrant, and I should go from a tympanic to a dull sound. While I'm doing that, I'm also going to check deep palpation. So when you check deep palpation for the liver, you're going to start under your rib where you hear the tympanic sound until you hear a dull sound, which is about right here, okay? So you should have about 8 to 10 inches, and that's where your liver should be. You're not feeling any tenderness whatsoever, correct, Morgan? Okay. Now I'll move on to basically palpation of her abdomen, and I'll start with just a light palpation. So are you feeling any tenderness whatsoever as I'm palpating around your abdomen? None whatsoever, okay. And what about on your flank down here? Nothing, okay. And then on this, no, okay. As I palpate her liver, I'm just going to kind of tuck my fingers underneath her rib cage right here. Are you feeling any tenderness whatsoever there? Okay. And then also to check the spleen, you should be able to feel the spleen as you palpate deeply, and I'm not feeling anything there as well, okay? What about palpation over your umbilicus? Are you feeling any pain or tenderness there? No? Okay. So Morgan doesn't have any ascites. If she did, I would be able to see fluid. So ascites is fluid buildup in your abdomen. I'm not seeing any fluid buildup whatsoever, okay? There's a few tests that you can do to check for ascites, and one of them is basically just percussing around the abdomen, which I did earlier. When I do this, and then also if I go on to the flanks, I should get a dull sound, which I do, a tympanic sound. I'm going to have you roll on your side, okay? So if Morgan was, if she had ascites, basically all that fluid would shift down as she rolls over. Sorry, Morgan, I know, you're so self-conscious of your belly. So, and then you would just percuss as well. I'm not seeing any or hearing anything at all. Okay, I'm going to have you lay back on your back. What I want you to do is we're going to do the wave test. So I'm going to have you put your hand like this, okay, so right in the middle, so in her midline. And basically what I would do is just kind of move her belly from side to side. Oh, I know, it's hard not to laugh with this. But I'm not seeing any fluid shift because there's no fluid in there. If she had ascites, then I would see a fluid shift from side to side. I'm not seeing any of that. Okay, and then also let's just percuss your bladder. Don't pee your pants. Okay, no tenderness there. Okay, so if she was to have appendicitis, you can check for what's called rebound tenderness. Basically, you would push hard on your lower right quadrant. And Morgan, did you feel any pain or tenderness with me pushing down or releasing? Okay, so if she did have appendicitis, by me pushing down and releasing quickly, if she did have appendicitis, then she would feel that rebound pain with that appendicitis. But I'm not seeing any kind of appendicitis positive test there. So that concludes our gastrointestinal and abdominal assessment on my patient Morgan. Thank you, Morgan.